Coronavirus disease 2019, a highly communicable viral respiratory disease, is responsible for the pandemic that has negatively affected the mental health of humans living in various countries around the world. It is reported that 53.8% of those surveyed disclosed that the pandemic moderately or severely impacted their mental health in a negative way due to consequences such as the death of a loved one, lack of basic needs, and lack of normal social interaction. Due to this detrimental state of mental health, citizens ages 25 to 49 were found to have increased their alcohol consumption in order to cope with the difficulty of the pandemic. Within this age group, parents of young children have been uniquely affected due to working from home, educating as well as entertaining their children, and caring for the family. During the COVID-19 pandemic, families have been faced with major lifestyle changes in order to cope with the restrictions and precautions associated with mitigating the spread of this mysterious virus. As a result, parents have lacked the resources to adjust to life with children who have been kept from school, childcare, or recreational activities, which has placed significant stress on their jobs, relationships, and mental health. The purpose of our research was to investigate the levels of self-perceived stress among adults during the COVID-19 pandemic. Many research studies have concluded that the pandemic has had a negative impact on mental health of adults around the world. For our study, 169 participants aged 18 to 65 completed a 20-question online survey, and their results were quantified using a screening tool developed by the authors, the Self-Perceived Anxiety and Stress Tool. We then downloaded and analyzed the data using statistical analysis software. In researching the effects of the COVID-19 pandemic on perceived stress levels in adults, we found that among the subjects who responded, females scored significantly higher when compared to males. We also discovered there was a significant difference among age groups. Additionally, employed respondents were significantly less stressed when compared to unemployed individuals. There was no significant difference among ethnicities, parental status, number of children, or being a single or joint parent. Additionally, there was no significant difference between the parents of children that attended in-person learning versus online distance learning. The results of the survey indicate that females, persons aged 25 to 44 years, and unemployed individuals were most in need of mental health services. Future studies should include larger, randomized controlled trials to determine the implications of a global pandemic on the mental health of the population. Thank you.